After watching my previous video, I hope you guys have the basic understanding about what is coronavirus and what are the things we can do to prevent it. This novel coronavirus pandemic has resulted global health crisis. This has been powerful enough to attack almost every country and territory in the world irrespective of the power, wealth, religion or technological ability. Since this virus spreads all around the world in rapid pace, it is better to have an idea about the stages of coronavirus spread. Therefore, from this video I am going to explain the stages of coronavirus spread and country-wise analysis of how they stand based on the stages. For this I am using Sri Lanka as a primary example. According to World Health Organization, stages of coronavirus spread simply means the way of this virus is transmitting within the country or region. Mainly there are 4 stages of virus transmission. The first stage of virus refers to the time when there is no locally originated cases but cases which only imported from the foreign countries. Foreigners and people who have traveled abroad test positive for respiratory illness. At this stage there is no spread of the virus locally. When it comes to Sri Lanka, they have been past this stage on 26th of January, when a Chinese woman tested positive for virus. The second stage means when there is local transmission begins and importantly, its source is known and can be identified, which means in this stage, usually be relatives or closely connected people of the infected patient who has traveled from abroad, will test positive. Fewer people are affected at stage 2 and it is easier to do contact tracing and prevent further spread via self-quarantining. Accordingly, in March 11, Sri Lanka has passed second stage of virus spread when they have identified 52-year-old Sri Lankan tour guide as infected person. When it comes to the third stage of virus spread, we call it as community transmission. There are further 2 stages of this third stage such as stage 3A, which is home cluster stage, and stage 3B, which is village cluster stage. During these stages families of infected person and villages of the area that infected person lives will be get affected, and according to the World Health Organization in this stage source of infection can't be traced or isolated. Outbreak will spread fast among clusters. Based on current facts, Sri Lanka is passing stage 3A situation. Any country which is in this stage has to take this very seriously. As the final stage of virus spread, the stage 4 is the worst and dreaded stage of infection, where it takes on the form of an epidemic. Massive numbers are infected and it is very difficult to control and contain the virus transmission. Based on the current world coronavirus pandemic updates as of 1st of April 2020, more than 910,000 people are infected within 203 countries, more than 46,000 deaths and only close to 200,000 people have been recovered. But so far Sri Lanka was able to maintain it at the minimum level with lockdown and other controlling mechanisms, including massive support from healthcare sector. Accordingly, there are 143 infected people with only 2 deaths and 21 people have been recovered. Based on given status and analyses we can see, following country-wise stages. China has already dealt with 4th stage of virus and they have been recovering at the moment. But unfortunately America, Italy, Spain, Germany and few more countries are suffering from this stage 4 spread. Most of the countries including Sri Lanka, India, Singapore, Russia and England have been passing through 3rd and 2nd stages of transmission. Hope you have understood the severity of the COVID-19 pandemic, and we are kindly requesting you to cooperate with the efforts of authorities by adhering safety measures and by following healthcare guidelines. We are planning to give insights about this coronavirus in future videos, so don't forget to subscribe our channel too. Together we can. Stay home, stay safe.